Hi, welcome to episode 4.1 of OSCE with Motao ES, and today I'll be doing maintenance of intravenous therapy. This procedure is about caring of patients on intravenous fluid therapy. As part of standard precautions, always start with washing your hands to prevent cross-infection. Building rapport and familiarizing yourself with the patient is very important. Greet and introduce yourself to the patient, and also introduce your supervisors or assessors of the day. Batupili principles requires patients to have more information about their health and services rendered. Explain thoroughly and briefly the procedure that you are going to do to the patient. Immediately when done, ask for consent, as it's also the patient's right in the patient's right charter that states that patients have a right to informed consent. Assess the following things to determine the patient's needs. Ask the patient if is there anything he or she wants before you start with the procedure. Ask the patient to see if the patient is comfortable before you begin with the procedure. And immediately when done, also check the immediate environment of the patient's surrounding to make sure that it's safe and clean to do the procedure, as in accordance with the patient's right charter that states that the patient has a right to a safe and clean environment. To ensure that the right procedure is done to the right patient, properly identify your patient to comply with the hospital policy that states that all patients admitted should be identified from admission up until discharge. In addition, make sure that you check your prescription as prescribed by the doctor, as it is a critical point. Thoroughly assess the condition of the patient to exclude any abnormalities. If found, manage it promptly. As part of a critical point, to prevent tissue injury, you must inspect the site of incision to check on redness, swelling, pain, leakage of the IV line, and the transparent dressing if it is intact or not. Tools you're gonna need to proceed with this procedure includes prescribed fluid vacuolator, information sticker where you'll be able to write the name of the patient, registration number, the date that the vacuolator was put up, the time, expiry date, and also the time it was put up. Also, you will need an apron and gloves for your protection, the cotton wool to clean the incision site if it's not clean, adhesive tape to put on with cotton wool if you are removing the vacuolator or the incision site, dressing trolley which has the paper bag, 2 paper bags, one on the left, one on the right. The paper bags must be labeled, each medical waste, the other one should be labeled as general waste. You must also have the patient's bed letter and also a black pen for you to record. To prevent cross-infection and contamination, decontaminate your hands. Wear your personal protective equipment. In this instance, you will be wearing your gloves and your apron as per hospital protocol. This is done to prevent infection cross-contamination. Once you are sterile and protected, proceed to palpating the incision site for tenderness. If the site is wet, dry the site with gauze. Report any abnormalities you find to the sister. This is done to exclude the tissue injuries. In addition, check the intravenous line for if it's leaking, if the correct intravenous solution is being used as prescribed. Check the fluid level in the chamber. Check if the pipe does not have the air bubbles inside. Check if it's not kinked so that it allows correct flow. Check if the regulator clamp is also functioning perfectly, and check if there's no backflow. This is all done to prevent fluid loss. please don't forget to decontaminate your hands to prevent spread of infection before you proceed. For continuation of therapy, please change the solution when the vacuolator or the bottle is empty or when a new vacuolator is prescribed in the prescription form. To enable proper priming of the line, make sure that the drip chamber is half full. At the same time, use the roller clamp to stop the flow of the drip. This is to prevent wetting the linen. Before you change the vacuolator, make sure that the vacuolator you have, it corresponds with the vacuolator prescribed as a new one or an old one in the prescription book. Immediately when done, check the expiry date of the new vacuolator, even the lot number. This is to make sure that you are not using an expired material or solution. When everything is corresponding, make sure that you remove the protective cover on the vacuolator bottle. Normally it's blue. This is to make sure that there is easily connection of the lines. Connect the chamber of the vacuolator without contaminating the drip. This is to allow or to prevent infection. Once you unclamp the vacuolator, make sure that you check for air in the tubing and expel it if present. This is to restore fluid balance. As part of a critical point, you must calculate and regulate the flow of infusion according to the prescription. This is done so to also restore fluid balance. The calculation will include flow rate is equals to total volume of fluid multiplied by drop factor and all divided by time of infusion in minutes. To exclude complications, please make sure that you observe your IV line therapy on the patient if it's still running well, if there are no bubbles, if it's not kinked, and also at the same time ask the patient's comfortability with the IV. In order to properly discontinue an intravenous therapy, wash your hands and thereafter wear your gloves as a protective measure and also to prevent cross-infection. Another critical point, to prevent air entry in the tubing line, clamp the tubing using the blue, sometimes it comes in white color, rolling the wheel down. To prevent injury on the patient, gently remove the dressing and tape from the insertion site on the patient's hand or arm. After removing the IV eye line, apply pressure with gauze from the insertion site which was opened. This is to make sure that you prevent bleeding. Apply the pressure for about 2 minutes. This is also a critical point. Discard the tubing and the empty vacuolator, including the dirty gauze that you've been using on the patient. This is to prevent cross-infection. Don't forget, always evaluate, 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 and evaluate. This is to ensure that the correct performance procedure was done and carried out successfully. Coming to the last critical point, make sure that you record everything, all relevant charts, and also report everything to the sister. Don't forget, record everything in accordance with the record keeping principles.